All right. And with that, I'm going to introduce Avenova. I first want to thank you for being here and thank you for the wonderful support that you give WooU so we can have fantastic presentations like we heard. So I'm going to turn the presentation over to you.
Great. Thank you, Dr. Stewart. Thank you to everybody who's staying on. We promise to make this a very short but sweet Avenova presentation for you this evening. I would like to introduce you to Dr. Nick Lilly. Dr. Lilly graduated summa cum laude and valedictorian of his class at the Illinois College of Optometry in 2011. Dr. Lilly wasted no time and started his practice in Allendale, Michigan, straight out of graduation. Recently, he has expanded into a larger facility and started the Rejuvenation Dry Eye Center. He also hosts the Ultimate OD podcast and loves talking about all things optometry. So, without further ado, I introduce you to Dr. Lilly.
Hello, hello. So if Bree, we could go to the first slide, the clean eyes or healthy eyes. Excellent. So one of the things that I'll start off with saying is when you're going to start any kind of dry eye practice clinic, even if you're a primary care clinic, you have to address dry eye. It's what's in our patients, but you have to get that surround sound buy-in from your staff. And clean eyes or healthy eyes is a great start to that moniker or what you say. In my office, I like to talk to my patients about stable tear film. My staff will talk about the tear film being the foundation of vision, from contact lenses, glasses, being compliant with medicine. Have a way that you're going to get the message out, and I think this is a good start. So, Bree, can we go to the next slide? So I'm not gonna lie to you, about 3 years ago, when I was starting the idea of starting the dry eye clinic, I came across hypochlorous acid and I had no clue what it was. Really didn't have an idea. But then I found Avenova and I did a little bit of research. I didn't want to just go willy-nilly into something. And it's a biomimetic. So when white blood cells are challenged, this is the secret sauce that they produce to kill bacteria, to kill toxins, and it's incredibly safe and gentle. That was my biggest concern is this an acid that I have to be really careful with? And it's not. It's awesome to use, and I kind of want to explain how I've incorporated it into my practice. So next slide, please. So when I started going to CE, any lecture I went to that involved ocular disease like conjunctivitis, the betadine wash was the claim to fame. And I was like, that sounds awesome. I can help my patients recover from conjunctivitis quicker. And then I did a betadine wash, and it is not fun. It's messy, it's uncomfortable for the patients, and it's really toxic to a compromised cornea, right? It's in a state of inflammation, and betadine just really is harsh on that eye. Now it reduces the viral load, but that's where Avenova comes in. It's broad spectrum. It covers more bacteria than betadine. In addition, it's twice as fast and it's incredibly less toxic. So that's why I like to use this off-label, of course. But when my patients have a viral conjunctivitis or even a bacterial conjunctivitis, I'll give them a steroid or I'll give them an antibiotic. But I'm also saying use this. It's going to help you recover quicker. And anecdotally, my patients feel like they recover faster. And then once they see the results with that, they're using this year round. So next slide, please. Some clinical pearls, areas that you can use it. So I kind of mentioned there, I use it with my conjunctivitis patients, but in addition, Demodex. My staff hates me because I'm writing so many prescriptions for Xdemvy, and prior authorizations take time. Not every patient can afford it. So I have to give them something in the meantime because their eyes are irritated. This is where Avenova is awesome. It's going to be the catalyst that's going to make Xdemvy that much better. And if they can't get the prescription, if it doesn't work out, this has, in my experience, been effective at reducing the viral or the bacterial load for Demodex. Patients that come in with eyelash extensions, gross, but they need to keep them clean. And these patients do not want to do anything that's going to mess up the beauty that they have of their eyelashes. Avenova is great because they can just do a little spray above and it helps kill the bacteria, keeps them from having, really bad infection. So I always talk to my eyelash extension patients about that. And then we do a lot of IPL in our clinic, and I love IPL. It's amazing. The one thing that I found is that after the 4 treatments, they have relief, but they're going to regress. They can go longer without regression if they're doing something at home. And Avenova is something that we give to every single patient complimentary with IPL treatment, and they're coming back and getting more because they notice a difference when they're using it. And then our ocular surface optimization patients, we do a lot of amniotic membranes and stuff like that, but not every patient qualifies, to get that covered by their insurance or whatnot. So Avenova is another way that we can optimize their ocular surface and give them better outcomes with cataract surgery. So just a few areas that I use it amongst other things. Next slide, please. So this is the big, cycle that we need to stop. You get a overgrowth of bacteria on the lids and lashes, and then lipases are breaking down the lipids. And you ever wonder why patients always complain about their eyes burning? Well, when lipases break down lipids, that's saponification. They're making soap, and they literally have soap in their eyes. That, in addition, has caused inflammation, and then an inflamed gland is not going to express and will lead to dropout. When I'm talking to my patients and I'm trying to get them to buy into this, a lot of times they're contact lens patients, and I'll talk to them about, you lose these glands, you're not going to be able to wear your contacts. I know you hate your glasses. We have to get to the root cause, and that's where Avenova will come in, and it gets right to that bacterial overgrowth. It's stopping the cycle before it starts. Next slide, please. So the big 4 things that I want you to take away from this is, remember, get rid of the betadine, use this broad spectrum, it kills the bacteria, it penetrates the biofilm. So in my office, we have things like Zest treatments. They're highly effective, but the patient has to come in. They have to go through the process. It takes chair time to keep them and keep those treatments more effective. Avenova will penetrate that biofilm. It neutralizes the lipases, so they get less of that burning saponification of their tear film, and reduces inflammation. Our bodies are riddled with it. Our patients are coming in and they're inflamed. Let's stop it with something they can do on a daily basis at home. And then the next 4 things, it's not irritating. I have 4 kids, 2, 4, 6, and 8, and I want to clean their lids and lashes. It's a curse of mine that my kids have horrible blepharitis, and I'm an eye doctor that prides myself in treating it for my patients. So I use this on all of my kids before they go to bed. And my 2-year-old boy, he'll come up and he wants to be like his big sisters, and spray it in his eyes, and he's not closing them, and he doesn't complain. He just kind of shocks, and it's good. So it's really easy on the eyes. It's not in antibiotics, so you don't have to worry about antibiotic resistance. It's no contraindications, and like I said, I use it on my kids, pregnant, lactating. There's no restrictions. I think it's really awesome that we have something as simple as this that helps our patients see. It helps our contact lenses be better and just better overall vision. Next slide, please. So this is what we're encouraging them to do: to wash their face, spray, and then wipe it away. Now, this is a pro tip that I've noticed in my office. Patients, believe it or not, are not 100% compliant. So anything we can do to make this more effective, I try to do. So I love the idea of washing your face and wiping. However, I want to make it easy. So I tell my patients, when you brush your teeth, morning and night, that's when I want you to spray. I was telling them to wipe, but they think they have bacteria. They go a little crazy and they can be a little harsh on their eyes. And I was having patients come back and they're like, my eyes are so red and irritated after I do this. And I got down to the bottom of it, and they are rubbing, like they have to just scrape away the bacteria. So I don't do as much of the wiping. It's better for the patient. If you can get them to do it softly, it's going to reduce that bacterial load. But I just do a little spray, and that, something as simple as that, is having an effect on my patients. So that's how I use Avenova, a background in it in a nutshell, and hopefully you guys can use it in your office, because honestly, it's been a game changer for me.
Thanks so much, Dr. Lilly, for sharing your insights and highlighting all the clinical uses and the benefits of Avenova with our doctors tonight. Avenova spray is now offered with a full line of companion products, including our dry wipes that we just talked about. They're really thin and easy. You wrap it around the index finger of your dominant hand and right on those lid margins. Super easy. You don't have to scrub. We also have eye compresses, lubricant eye drops. I'm going to say lubricant eye drops, not artificial tears, and the eye check. And the eye check is a tool that helps patients to monitor their lashes at home. Bree will share the sample link soon, and we'll discuss the availability of sampling all these products along with Avenova. And Avenova has always been available for in-office dispensing, but we've added other channels to the market. We want it to be omni-channeled. This slide illustrates all the ways that NovaBay has worked to ensure that your patients can make lid and lash hygiene a part of their regular twice daily routines. We offer an in-practice dispensing program, so you get Avenova into the hands of your patients and onto their eyelids and lashes the same day. We offer wholesale pricing to you, so retailing Avenova produces a steady revenue stream and for your practice and ensures your patients get the product that you specifically recommend. As a bonus tonight, we're also offering an additional 20% discount off the wholesale price of Avenova with our WooU20 promo code. And lastly, we still have Avenova available by prescription, but you can really reduce the amount of prior authorizations you get by simply using one of our specialty pharmacies, and they're available across the country, including Imprimis RX pharmacies with really discounted pricing and free home delivery. All right, thanks Bree for getting us here. It's our last slide. We're going to talk about all the bonus offers that we have for you. Let's, get together. Let's have lunch and let's talk about Avenova, answer your questions and nosh a little bit along the way. Go to the link that Bree will share, find your area, click on it, and let's set up a time to talk about Avenova. We also have free samples. I think Bree already has that link up. Give it a go. Go to our website, trial Avenova, use it yourself. Have your aunt, your mom, your staff member that you know has issues with lid and lashes, and whether it's bleph or chalazion styes, let them try it and let them tell you in a week or two how much better they feel. And lastly, we talked about that 20% off WooU discount off our wholesale prices. Use it or lose it. It's there for you. All righty. And I think we are going to get to, if you have eyes, you should use Avenova. It's our mantra: safe, easy, effective, and affordable. And we'll turn it over to any questions that you may have about the product.
Thank you, Jen. Thank you, Dr. Lilly. We appreciate everybody for staying on. We'd like to open the Q&A right now. Looks like we have a few questions on here. Dr. Lilly, can you talk about FSA, or Jen too, FSA and HSA eligibility? We're at that time of year, right? We're looking to use up all of our funds before we lose them.
Absolutely. We do encourage our patients to use that when they're purchasing it. And one of the tips that I'll say is, if I'm scheduling a 3 to 4 month follow-up, I'll try and, when I go to check the patient out, let them know, especially at this time of year, let's make sure they have enough to get them through until their next visit. When it's end of the year, they will kind of jump on that because they have money to use.
Great. And Dr. Lilly, you touched a little bit about sharing having younger children and using Avenova on your kids. Is there any reason that somebody shouldn't use Avenova?
There's none that I can think of. I haven't seen any instance where it's not effective or it's going to be contraindicated.
Great. It doesn't look like we have a whole lot more questions. I'd like to leave it open for a second in case anybody would like to throw a question in the chat, or throw a question in the Q&A panel. If not, please, we encourage you to go click the links, go to our website, request a sample. Somebody from our team will reach out to you. And we genuinely thank you for spending time with us this evening.